This is what the COMPONEER box looks like. Again, they keep changing things, and there's different options with it, but there's two types, okay? There's a universal shell that you can see at the top there in gray, and then there's a white opalescent shell that's in the black boxes. And there's basically a small, medium, or a large. The smalls you don't typically use. I guess you could maybe use them for pedo or something, but typically you'll use a medium or a large. And you'll use a universal if you want to keep it more, you know, you're doing one or two teeth and you want to match it, or you'll do it a white opalescent maybe if you're going with a smile makeover. And I'll show you lots of stuff with them, but what's important is that they're only 0.3 millimeters thick, so they're really thin. Sometimes you'll prep, sometimes you won't prep. It depends on the case, but what makes them important is that on the intaglio surface, as you can see with the microscope, little kind of picture right there, is it has a rough intaglio surface, and that's what allows the bond of the COMPONEER to stick to the tooth with composite. And I'll show you as we go through. But initially, kind of how I got started, I said I practiced with my dad, and I started doing these COMPONEERs like 10 years ago when they came out. And my dad had actually taken the course down at the ODA, and he bought that box and that kit. And I never took the class. I didn't take it, but I had a patient show up because we have our own in-office lab. My older sister runs our lab. And a patient showed up on a Saturday, was here for a wedding, and she lost a veneer and wanted a veneer made because we had our in-office lab. And I was like, well, that's not how it works. Can't just make a veneer that fast. And then I was like, well, I guess I could try this kit. So I went and pulled this box out. I hadn't even taken the course. And I remember I was just kind of following the instructions, like with my assistant. It was kind of like a paint by numbers thing. And we put one on, and it looked great. It took about 20 minutes. And the patient to this day, I lost track with her because she lives in North Carolina, but she still has that COMPONEER in there mixed with all those porcelain veneers. And so from then I started doing them, and obviously I started showing Coltine some cases, and that's how Coltine reached out to me to start teaching how I do these and talking about them. But what's nice about these is they're a one visit. Typically when I do a smile makeover like this, it's about 2 hours. I say about 20 minutes a tooth. And like on this one, 8 and 9, obviously those centrals, we wouldn't have to prep. We could just put those right on top of 8 and 9. And then the other ones, we clean up the decay and put them on. Here's another one where she couldn't afford traditional veneers. She had treatment planned them with other offices and ended up hearing about COMPONEERs. And so we did the COMPONEER option.